this amazing rapid revision image based revision of pediatrics part 2. Please let me know if my voice is coming in the comments so that we can start this beautiful class and share some good knowledge. Good evening to all the students. Is my voice coming, yes or no? Hello, let me just type the hello, and I'm asking, is my voice coming, yes or no? Yes, class will stay for 30 to 40 minutes. Quick rapid revision of pediatrics. I hope my voice is coming, yes or no. Hello everyone. Today we're going to talk about images. I'm going to talk about some important recent last 3-year question papers. Yes, the voice is coming. Okay, okay. Please let me know. Yes, we're going to start this class. Yes, hello everyone. Good evening, Blackie. Good evening, Okay, so someone is saying yes, the voice is coming. Someone is saying it's not coming. Is my video coming, yes or no? Okay, perfect. Okay, is my video coming? Blackie Chan says yes, it's coming. Oh, now it's coming to me also. This gorgeous, handsome, white face. Who is saying my face is not coming? It is coming to me. Let's start. Hello everyone, welcome to Pediatrics by Dr. Anand, and let's start this crazy class and share some good knowledge. Before starting any segment, we always have a beautiful quote, and this quote will be in Hindi, which will be explained in English. The Hindi quote says, एक दिन शिकायत आपको वक्त से नहीं अपने आप से होगी. एक दिन शिकायत आपको वक्त से नहीं अपने आप से होगी कि खूबसूरत जिंदगी आपके सामने थी लेकिन आप उसे देख नहीं पाए. आई रिपीट अगेन इन हिंदी. दिस ब्यूटीफुल कोट फ्रॉम महाभारत सेज, एक दिन शिकायत आपको वक्त से नहीं अपने आप से होगी. वन डे यू विल हैव प्रॉब्लम नॉट विद द टाइम, यू विल हैव प्रॉब्लम विद योर सेल्फ. वाई? कि खूबसूरत जिंदगी आपके सामने थी लेकिन आप उसे देख नहीं पाए. द ब्यूटीफुल लाइफ वॉज इन फ्रंट ऑफ यू बट यू कुड नॉट सी इट. वन डे you will have problem not with the time, you will have problem with yourself, that the beautiful life was in front of you and you could not see it. Sometimes we say, once I get a PG seat then I'll be happy, once I get a SR ship then I'll be happy, once I get married then I'll be happy. There is nothing known as the right time. This is right now is the right time. Successful is the one who enjoys his daily routine. Let's start this class. Yes, the first question on this planet. Let's crazily finish all the topics. What is this milestone? In the next 30 to 40 minutes I'm going to ask you some crazy billion questions. Are you ready to answer? Let me know. Yes, what is this? Is this sitting with support or is this sitting without support? I'll repeat again. In this beautiful picture, dude, what can you see? Is this sitting with support or is this sitting without support? Once the baby doing like this, when you see at the question paper, you do like this, kuch nahi aata, like that only. So that only is nothing but sitting without support comes by 8 months and sitting with support comes by 6 months. Very important. Okay, we have Chanukya who says, thank you sirs for speaking in English. Yes, this session will be predominantly spoken in English language only. Yes. Now this is a good one, dude. This is the good one. This is the clinical. Now we're talking about real stuff over here. Which maneuver is seen in the video? Can you please answer in the comment? I'll repeat again. Which maneuver is seen in the video? I'll repeat again. Yes, exactly. When the hip and knee is flexed to 90 degrees. This is a very good point. Can you please answer in the comment, my dear friends? When the hip and knee flex to 90 degree and then I hyper extend the knee joint, the patient experiences pain. The patient experiences stiffness in the hamstring muscles. So what are we doing it over here? Very good. Shubham says Brudzinski sign. Brudzinski, beta jaan se maar dunga Brudzinski. I will kill you. This is not Brudzinski, dude. Brother, this is Kernig sign. Kernig. Kernig sign, my dear friends. Please remember, this is a very important आज के ज़माने का crazy question. In this beautiful slide, I'm able to appreciate when the hip and knee is flexed to 90 degree and when I hyperextend the knee joint in this picture. Look at the photo again, dude. It's very important. When the hip and knee is flexed to 90 degree and you hyperextend the knee joint, the patient experiences pain. This is nothing but Kernig's sign, which is the sign of meningitis. Can you please answer quickly in the comment? What are the signs of meningitis? As we all know, there are 3 signs signs of meningitis. Very beautiful. The one in the video is nothing but Kernig sign. Photographic memory plays a very important role. These are my own real patients and this handsome person is me only in the video. So this is Kernig sign. दूसरे और क्या होते हैं? If I say the patient has a focal deficit, is this a sign of meningitis? If I say the patient is very irritable, is this the sign of meningitis? Even though if I say the patient is having seizure, is this a sign of meningitis? If I say the patient has a lateral rectus palsy, are these all the signs of meningitis? Yes or no? What do you think? What is your knowledge tells you? Please let me know in the comment section. Oh, we have so many students online today. क्या बात है? तुम सब कौवा खा के आए? Very nice. So we have Shubham, Riya Gupta, Zamyang. We have Madhav, Devani. We have Zen Mode. All hi-fi names. We have Surbhi, Divyesh, Dipanjan Roy. Dipanjan Roy, I know he's in my WhatsApp group. Great. Very good. Someone very beautiful says projectile vomiting. Okay, let me write it. Let me write it. Your 250-gram brains knowledge. Let me write it. Who said this? Someone said projectile vomiting is a sign of meningitis. Very good. Very beautiful. A proud moment. You should write your name on your forehead. Anything else? अच्छा और भी कुछ है. Please remember, dude. Projectile vomiting, irritability, seizures, lateral rectus muscle palsy, focal deficits. None of them is the sign of meningitis. The signs of meningitis are only three. One is the Kernig sign, second is the neck rigidity, and third is the Brudzinski sign. Brudzinski sign. Please remember the signs of meningitis are only three. Whereas if I ask you what are the signs of raised intracranial tension, then you can open your mouth and say projectile vomiting, irritability, seizures, focal deficit, lateral rectus palsy. Then whatever you want to say, bro, you can say. But these all are the signs of raised intracranial tension, or you can say signs of meningeal irritation. But the signs of meningitis remains only three, bro. They are neck rigidity, Kernig sign, and Brudzinski sign. I hope you're able to understand. Very quickly, we all have done this already. Where do you see strawberry tongue? Where do you see strawberry tongue? I hope you can know that. Exactly. Strawberry tongue, we all know it is seen in Kawasaki. Yes, it is seen in Kawasaki and it is seen in scarlet fever. Kawasaki and scarlet fever. Strawberry vagina was already a NEET PG question. It can come in INI CET also. Strawberry vagina is seen in trichomoniasis. Strawberry vagina, it is seen in trichomoniasis. Very good. Strawberry gingiva. Strawberry gingiva, quick answers please. Madhav. Yes, strawberry gingiva. Gingiva are usually small. So small vessel vasculitis. Small vessel vasculitis. Which ones are you telling? Bro, I'm telling about Wagner's granulomatosis. I'm telling about Wagner's granulomatosis. Please remember, this is really very, very important. Okay. Strawberry tongue, you see in Kawasaki and scarlet. Strawberry vagina, you see in trichomoniasis. Strawberry gingiva, you see in Wagner's granulomatosis. What else? What else? Strawberry scrotum. Please remember, use question number 1. Strawberry scrotum. Strawberry scrotum, you see in multiple sebaceous cysts. Question number 2, PG entrance. Question number 2, strawberry gallbladder, using cholesterolosis. And strawberry skull, you see in antenatal ultrasound in the Edward syndrome. Edward syndrome. 1, 2, 3, 4, 5, 6. 6 MCQs in 1 minute. These are like strawberry tongue has already MCQ. Strawberry vagina, trichomoniasis already last year MCQ. Strawberry gingiva already 2 years back MCQ. Now they can ask you strawberry scrotum, strawberry gallbladder, and strawberry skull. Next question, please. Very, very easiest question on this planet. Gray baby syndrome is a side effect of which drug? Yes, Shreya Singh, Aishwarya Yadav, Dr. RJ, Madhusudhan Ojha, and Chanukya. All hi-fi, very beautiful, sophisticated, high-class names we have. Gray baby syndrome is a side effect of, we all know that, chloramphenicol. Gray baby syndrome is a side effect of overuse of drug known as chloramphenicol. Bronze baby syndrome किस वजह से होता है? Bronze baby syndrome, dude, is because of phototherapy. Bronze baby syndrome is a side effect of overuse of phototherapy. Blue baby syndrome is because of amiodarone. Blue baby syndrome is because of overuse of a drug known as amiodarone. And red man syndrome is because of vancomycin. Red man syndrome is because of vancomycin. Next question, please. Finish. Blue diaper syndrome. Very good question. Can you please answer in the comment? Blue diaper. Yes, very good. We have Zen mode. We have Kirtana, Madhav, Divya, Madhusudhan, and Dr. Achal Thakur. Very good. And Dipanjan Roy. Blue diaper syndrome. Where do you see blue diaper? Blue diaper. Blue diaper syndrome is seen in a condition known as indicanuria. In a case of indicanuria, you see a condition known as blue diaper syndrome. Blue diaper syndrome you see in indicanuria. It is also known as Drummond's syndrome. Drummond apostrophe S. It is also known as Drummond's syndrome, where you see a bluish urine stained diaper. Urine stained diaper. Please remember. Next question, please. Thomson liver and Thomson score. Easiest question. Can you please answer in the comment, please? Yes, very good. डॉक्टर ऐश्वर्या यादव, yes, Thompson scoring कहाँ करते हैं हम? We have done that. Thompson scoring is done in HIE. If the baby has not cried immediately after birth, he can land up in an entity known as HIE, which is nothing but hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy. And for HIE, we have a proper staging. We can use Sarnet and Sarnet staging, and also we can use the Levene staging, and also we can use the modified Thompson score. The students, I'm saying, the newborns who are very neurological deficit, for them we can use this Thompson score. Thompson liver कहाँ होता है? Now this is a good question. Who will answer? Yes, we have your name, Guevera. I'll tell your name like that because it's difficult to pronounce. Yes, Kirandeep Kaur is right, Divyesh is right, Aishwarya Yadav is right, Kirthana, Shashwat, very good. Thompson liver होता है scarlet fever. Scarlet fever, Thompson liver. Scarlet fever you seen in Thompson liver. Thompson's liver is seen in scarlet fever. Thompson's liver, it is seen in scarlet. Okay, scarlet fever. Can you please tell me? I am new to Dr. Anand classes. Scarlet fever, I have no idea. Can you please tell me two important points about scarlet? क्या और क्या पता होना चाहिए? What do you think, guys? What else should we know? हाँ जी, दिव्या, किरणदीप कौर, दिव्येश. We have Guevera, Guvera. And Shashwat, yes, very good. So scarlet fever, sandpaper like rash, sandpaper, sanda nahi hai, sand, sandpaper like rash, sandpaper like rash, number one. And fever with rash on day 2, fever with rash on day 2, you will think of scarlet fever. So sandpaper like rash, fever with rash on scarlet fever, fever with rash on day 2, and Thompson's liver. The name of the liver we see in scarlet is seen in Thompson's liver is seen in scarlet fever. Finish. Very good question, guys. What do you think? Can you answer in the comment, please? Which beautiful picture is this, my dear friends? What do you think? Quick. Madhav, very good. Kirthana, very good. Riya Gupta, Divya, perfect. If I inflate my BP cuff slowly, my hand goes to a carpopedal spasm. This is very good picture. If I inflate the BP cuff, for this I would like to thank Dr. Nitin, one of my very wonderful, very genuinely nice juniors, and he's a wonderful person, top rankers in South India, and he had sent me this video. Thank you, Dr. Nitin. God will always bless you. So what is this video showing? Video-based memory plays a very beautiful role. So if I inflate the BP cuff, you can look at the baby's hand slowly. The hand takes a posturing like a spasm. Where do you see this? You see in a case of tetany. And what do you call this? We call, in this baby also, you can look at very carefully down the baby's hands. This only is nothing but kind of a tetany. You see in tetany, this hands like that. And this is known as Trousier's sign. Trousier sign. Exactly. Very good. Shreya is right. Charul Agrawal is right. Deep Shikha Arora, very beautiful. Dr. Aishwarya Yadav says, thank you, sir, for teaching pediatrics so beautifully. Because of you, passed FMG with flying colors, and I talked to you on video call. You remember, sir? That was one of the best day of my life. Aishwarya, that's very beautiful. That's very beautiful of you, Dr. Aishwarya Yadav. My good vibes are always with you. Bhagwan bahut de. Very beautiful. So yes, in a case of latent tetany, that if I inflate the BP cuff and the baby who does this posturing, that is known as Trousier sign. And then what about, and as we all know, there's one more sign known as chopstick sign. If you stimulate the angle of mandible, there's a twitching of the facial muscle. Twitching of the facial muscles in response to the tapping over the area of the facial nerve. If you tap over the area of the facial nerve, twitching, that is known as chopstick sign. Trousier sign and chopstick sign seen in latent tetany, that part is over. Okay, let me ask you something else. Very nice. Again, a very quick motivating quote which says, everything will make sense. Everything will make sense. The struggle, the pain, the hard work, everything will make sense by the end of the journey. The struggle, the pain, the hard work. Don't stop working. Just keep on going and everything will be fine. Look at this picture. You have 5 seconds to answer this question. What do you think? Yes, very good. 5 seconds. What is this picture? What is this picture? Can you answer in the comment? 5 seconds to you. Yes, we have Divya, Ashwarya, Zen Mode, Ashwarya Yadav, Soumya Deep Sikandar, and Nigar Ansari. Very good. What is this? Yes, 5 seconds. सब गाते हैं सब ही मदहोश हैं हम तुम क्यों खामोश हैं साज दिल छेड़ो ना. This is Treacher-Collins syndrome. Please remember Gandhiji's three monkey Treacher-Collins syndrome. This is the Treacher-Collins syndrome. Gandhiji said, don't hear the bad stuff. These children, they heard the bad stuff, so they got deafness. They got deafness. Gandhiji said, don't see the bad stuff. These children, they saw the bad stuff, so the baby got a coloboma. The baby got a coloboma of the iris. And Gandhiji said, don't speak the bad stuff. So they got hypoplasia of the cheek. They got hypoplasia of the cheek. That you should know. So very, very important. Treacher-Collins syndrome, coloboma iris, deafness, and hypoplasia of the cheek. That is nothing but very, very important triad of Treacher-Collins. Deepshika says congenital syphilis. Congenital syphilis, no, congenital syphilis is different. That is Hutchinson's triad. If I have shown you the teeth, dear, if I have shown you that there's no teeth in this picture, if I have shown you the teeth, then you could have told me Hutchinson's triad, which has Hutchinson's teeth, interstitial keratitis, and eighth nerve deafness. But yeah, I can connect that. You can connect these like Gandhiji teen bandar. You can connect in syphilis also. I totally agree with you. But Treacher-Collins syndrome is the thought of the choice. What is this? Is this a autosomal dominant or a autosomal recessive inheritance? Can you answer in the comment, please? AD or AR? Quick answers. Very good. Yeah, Deepshika, you're very right, dear. Very right. Perfect. We have an ID says and Ashwarya Yadav waiting for this your voice. Thank you. So sweet of you. So as we all know, Gandhiji, the three monkeys and these students, they were like kind of a very dominating students because they did not listen to Gandhiji, Gandhiji's thing. So that's why they are very dominating student. That is why Treacher-Collins syndrome, very, very important, is the autosomal dominant inheritance. Autosomal dominant inheritance, please remember. And can we quickly please remember, can you tell me any other disease which is autosomal dominant? Very quickly, I remember the mnemonic MAT. M for Marfan syndrome is autosomal dominant inheritance. A for achondroplasia is autosomal dominant inheritance. And T for Treacher-Collins syndrome, which we are studying right now, is autosomal dominant inheritance. Or M ka opposite of M is W. So Willebrand, von Willebrand disease also is autosomal dominant. And roughly autosomal recessive, if you have not read the topic of IEM, first of all, pray to God that you have not read. Pray to God that question should not come. वो अलग बात है कि अभी 6-7 क्वेश्चन आए थे पिछले पेपर में. So autosomal recessive, usually many of the inborn errors of metabolism, galactosemias, Wilson and all that, they all are autosomal recessive. Few, except few like a Hurler Hunter, the inheritance is different. That you should know. In this slide, I have understood that roughly many of the inborn errors of metabolism are autosomal recessive, and autosomal dominant, the mnemonic was MAT, Marfan, achondroplasia, and Treacher-Collins syndrome. अच्छा ये बता दिया नहीं बताया नहीं. I didn't tell you this. TCOF1, very important. TCOF1, T for Treacher-Collins, T for TCOF1 gene mutation. Star mark, it's already an exam question. Next question, please. This part is over. Oh yes, I know this. What is this? Long fingers. What do you call this? Can you answer in the comment, please? Long fingers. क्या बोलते हैं उसको long fingers को? Yes, exactly. Mr. X says you should have to give explanation of the comments. Very well, definitely I'll give. Should I give you explanation of my voice also? I am very good in singing. I'll give you an explanation of that also. Okay. Long fingers. Where do you see long fingers? Where do you see Mr. X? Do you have long fingers? Yes, I guess. So this is nothing but you see in erechnodactyly. Erechnodactyly. Very, very important. Dactyly means digit. Erecno means lambi, long. Long fingers are seen in long fingers are known as erechnodactyly. Where do you see erechnodactyly? One of the important syndrome known as Marfan syndrome. Marfan syndrome, which is the most, yeah, very good. Who told this answer? इतना प्यारा किसने आंसर दिया? Dipanjan Roy has told the right answer. Which is the, कहाँ चला गया? हाँ ये चाहिए रहा. So this was erechnodactyly. Can we quickly revise all the dactylies, please? What is brachydactyly? What is brachydactyly? What is syndactyly? See, dactyly matlab digit. Dactyly means digit or fingers. Okay, number one. brachydactyly, syndactyly, arachnodactyly, then we have clinodactyly. So these are dactyly, you should know. Okay, so brachydactyly means small fingers. Small fingers are brachydactyly. Arachnodactyly is long fingers. That is one thing is over. Syndactyly is fusion of the fingers. फ्यूजन ऑफ द फिंगर्स, दो उंगलियों का जुड़ जाना. फ्यूजन ऑफ द फिंगर्स इज नोन एज सिंडेक्टाइली, वेयर एज क्लाइनोडेक्टाइली इज नथिंग बट उंगलियों का मुड़ जाना. इनकर्वेचर ऑफ द फिंगर्स, दैट इज नोन एज syndactyly. Okay, brachydactyly, syndactyly, arachnodactyly, and one more thing good I remembered, polydactyly. What is polydactyly? Polydactyly is nothing but more than 5 fingers, more than 5. Hyperdactyly or polydactyly is more than 5 fingers. Very good. So beautifully told by Kirthana. We have again Dr. RJ, Surbhi, Charul Agrawal, Ashwarya Yadav, Mr. X, Divya, and we have Kirthana again and Charul Agrawal. Very good. Next important thing I would like to ask here is which sign, yeah, if we are thinking of Marfan syndrome, which sign is this? Now this is a good question. Can you please answer in the comment? Yes. Very good. What do you think? तेरे चेहरे से नजर नहीं हटती, नजारे हम क्या देखें. There are two things we must know in a case of Marfan syndrome. One is something known as wrist sign and something known as thumb sign. Wrist sign and thumb sign. These two signs are commonly asked in the exam. Wrist, like one is a, कहाँ चला गया? 1 second bro. ये मेरा हाथ लगता रहता है. Okay, wrist sign. 1 second. कहाँ इधर उड़ गया हवा में उड़ गया. 1 second. Can you please wait for 1 second? My fingers here and there, ये उड़ गया ये. Yeah, so this is thumb sign. I'll repeat again, this is the thumb sign, and we have the what you call wrist sign and the thumb sign. Wait, basically I'll tell you. So as we all know, very very important, you know. So wrist, what is wrist sign? Wrist matlab kalai. This is the wrist, no? My little finger and the thumb. Very very important. If they are overlapping, listen very carefully. Wrist matlab this is the wrist, no? This is the wrist. So this is the wrist sign. This is the wrist sign. My little finger and thumb, if they are overlapping, then I will say wrist sign is positive, seen in Marfan syndrome. It is also known as Walker-Murdoch wrist sign. Number 1. Number 2, then we have the other one is thumb sign. Other one is thumb sign. What is thumb sign? If I fold my finger, if I make a feast, if my thumb is protruding out, that means I have a thumb sign positive. It is also known as Steenberg thumb sign. So Walker-Murdoch wrist sign and Steenberg thumb sign is seen in Marfan syndrome. Marfan syndrome. Has everyone understood this much? Yes or no? Please let me know in the comment section. 30 minutes of class is already over. You can give a golden heart or a black heart or a blue heart or some kind of heart if you feel like you can give. समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? Please let me know. If it is going above the head, I recommend everyone you should take 1 teaspoon of honey. That will increase your brains, and also 5 almonds will be very nice if you take it. If you're going to gym, you can take 10. Later you can go for 12, but don't start with 12. You might get hot flushes and rashes. We're going to start off with 5. Okay, perfect, very good. Okay, yes, we have Blackie Chan who says, sir, you have Marfan. Yes, I have Marfan. Dekho. Which of the following is not associated with development delay? Good latest questions for this one. Even in MRCPCH also it came. Which of the following is not associated with developmental delay? It's a very good question. Duchenne muscular dystrophy, Marfan syndrome, spinal muscular dystrophy, Tay-Sachs disease, and Prader-Willi. किसमें developmental delay नहीं मिलता? Very good. We have the ID. He says the dog. He says and the red heart, yellow up. Thanks, bro. Very kind of you. Perfect. So can you quickly answer in the comment? 30 minutes of class is already over. Please remember, developmental delay is not seen in Marfan syndrome. B is the best answer. Someone said D. Please remember, Tay-Sachs disease, that too is like proper neurodegenerative disorder of a gray matter, and the baby expire in 3 to 4 years of life. It definitely will have a developmental delay. Whereas in the case of Duchenne and Becker's, the baby will not be very good in school, and like slowly kind of deterioration will be there. They will have slight developmental delay. SMA also, spinal muscular atrophy, and Prader-Willi, they will have a learning problem, nothing but developmental delay. But Marfan Okay, the dog. Marfan syndrome, definitely. I have met those people personally. I have met a girl of Marfan, and she was very good in sports. Her mother was so happy and so excited. She's very good in sports. Next month she has a throw ball competition. She always win in the classes in her school. Do you recommend sports activity to a Marfan? What do you think? Okay, next question, please. Yes, very good. A beautiful quote which says, "घमंड है तो किस बात का? यहाँ हम सब किराएदार हैं." So very beautiful quote which says again from Mahabharat which says घमंड है तो किस बात की, अकड़ है तो किस बात का, यहाँ हम सब किराएदार हैं. दूसरों से क्या ही करोगे, the life is already very small. Okay, so make sure you just enjoy life instead of criticizing and doing drama here and there. Where do you see string sign? A good question. Last year it had come. Where do you see string sign? String sign you see in congenital hypertrophic pyloric stenosis, CHPS. You see a string sign. Even also if someone asks you, where do you see double tract sign? String sign and a double tract sign, where do you see? Where do you see? You see in a case of CHPS, congenital hypertrophic pyloric stenosis. Can you please tell me the name of the surgery for CHPS? Can you please quickly revise? Yes or no? Very good. Nimra. Very good. Kirthana. Very, 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 very good. The name of the surgery for CHPS is nothing but Ramstead pyloromyotomy. Ramstead pyloromyotomy. A pyloromyotomy. Yeah, very good. That is the name of the surgery for CHPS. The mother would have taken which drug during pregnancy in a case of CHPS? Can you please answer in the comment? Cheshtha Arora, Aishwarya Yadav, again Cheshtha, and Dr. Yashwant. Good evening, Dr. Yashwant. So, question क्या था? Yeah, the mother would have taken erythromycin. If the mother has taken erythromycin during pregnancy, the baby can have CHPS. If the mother has taken danazol, during pregnancy, the baby can have dash. Can you answer in the comment? Very good. Yes, yes, yes. If the mother has taken danazol, the baby can have virilization. The baby can have virilization. Very good. Next question. If the mother has taken misoprostol, during pregnancy, the baby can have. Can you answer in the comment? Very good. M for misoprostol, M for Mobius syndrome. M for misoprostol, M for Mobius syndrome. Very, very good. So Mobius syndrome also is the good answer. Okay. Danazol हो गया, cocaine हो गया, microcephaly, this, that, everything is done. Double tract sign I've already told you. You see in CHPS, the name of the surgery for CHPS is nothing but Ramstead pyloromyotomy. What is the name of the surgery for GERD? What is the name of the surgery for GERD? What is the name of the surgery for TGA? And what is the name of the surgery for HLHS? Very hi-fi good questions. Can you answer in the comment? गलत आंसर दे के दिखाओ तुम. निगार अंसारी, कीर्थाना, we have this huge name. पहले पढ़ लूँ स्पेलिंग में. आहिल आहिल आगे आहिल अरशद छोटी. Okay, good. Chesha Arora, very good. If the name of the surgery for GERD will be nothing but I'm gonna do a Nissen fundoplication. Once first initially you will not answer. Then once I tell you the answer, you'll be like, oh yeah, मुझे पता था, मुझे पता, I knew it, I forgot. The name of the surgery for GERD is Nissen's fundoplication. For TGA, we're gonna do a Jettini repair. That's already a star mark exam question, or you can say arterial switch. Okay, TGA or a Jettini repair. For TGA, transposition of great arteries, we do a Jettini repair or a arterial switch. For hypoplastic left heart syndrome, we will do a procedure known as Norwood procedure. Norwood procedure is done in a case of hypoplastic left heart syndrome, where the surgery is done in multiple segments. Hypoplastic left heart. In for one surgery, I'll make your left atrium. Another surgery, I'll make your left ventricle, and things like that. Next question, please. Next beautiful quote which says, make yourself the best and destiny will do the rest. Whatever you're doing, put your good heart and soul, genuine thing in your hard work. Instead of criticizing, instead of commenting, instead of blaming, that won't give you success. That only will give you waste of time. So focus and enjoy life. That's very important. Oh, now this is a hi-fi question. 6 questions in one slide. Where do you see Christmas disease? Where do you see Christmas tree cataract, Christmas tree rash, Christmas tree adapter, Christmas tree appearance of polyp, Christmas tree sign, and Christmas tree bladder? 1 minute and 7 MCQs. What else do you want in life? Christmas disease. Where do you see Christmas disease? Who will tell me? Raise your hands. Okay, my doggy also knows. ऑस्कर क्रिसमस डिजीज कहाँ मिलती है? अच्छा, दिस इज नो, हीमोफीलिया बी, क्रिसमस डिजीज यू सी इन हीमोफीलिया बी, क्रिसमस ट्री रैश, वेयर डू यू सी क्रिसमस ट्री रैश? पिट्रियासिस रोजिया, pityriasis rosea. How do you differentiate pityriasis rosea with tinea corporis? How do you differentiate pityriasis rosea with tinea corporis? Tinea corporis will have an elevated border with central clearing. So the rash is there, no? The borders are little elevated with central clearing, whereas pityriasis rosea lacks elevated border. Pityriasis rosea lacks elevated border. So Christmas disease is seen in hemophilia. Christmas tree rash is seen in pityriasis rosea. Christmas tree cataract, ये तुमने पढ़ा हुआ है. Where do you see Christmas tree cataract, my dear? Christmas tree cataract. Christmas tree cataract you see in myotonic dystrophy. Christmas tree cataract you see in myotonic dystrophy. Where do you see this one? What you called? Christmas tree adapter. Christmas tree adapter used for oxygen tank. Christmas tree adapter for oxygen tank. Christmas tree rash for pityriasis rosea. Christmas disease is hemophilia. Christmas tree adapter is for the oxygen tank में जो adapter होता है. Christmas tree bladder you see in a case of cystographic appearance of the neurogenic bladder, and Christmas tree sign you see in a paraspinal CSF leak in radionuclide cysternography, remember, okay? And Christmas tree appearance of polyp you see in Peutz-Jeghers syndrome. What is this picture? A very good picture. When the cranium is attached of the two babies, what do you think? What is the best answer for this question? As we all know, something known as pagus, something it has to do with the pagus. There's something known as craniopagus. When both cranium are attached in the baby, that is known as craniopagus. There are various types of pagus. If my thoracic part is attached to baby's thoracic part is attached, that is known as thoracopagus. If the potty area is attached of two babies, that is known as pyopagus. Cephal part is attached, cephalopagus. Thorax is attached, thoracopagus. This is cranial. You can say cranial, na? Exactly. You can say craniopagus. Again, a quick punchline: be a warrior, not a warrior. Be a warrior. We have to fight this, okay? And it's very easy. Next question, please. Yes, very nice. I have a question. A girl child, a patient who has a twitching of fingers and dropping of objects. A patient has twitching of fingers and dropping of objects. Twitching of fingers and dropping of objects, number one. Number two, the patient has, now this condition which I'm talking has a very good prognosis, and the drug of choice for this condition is sodium valproate. So what is the best answer for this question? I have told you the full MCQ only the main disease I have not told you. What do you think? Very good, very good. We have Shashwat who says, great session, loving it. Thank you, Shashwat. Very sweet of you, Shashwat. So very beautifully told by Minakshi. We have an ID known as I am Donald, Mr. X, Deepa, Aishwarya Yadav, Kalpana Ravi. A patient who has twitching of finger and dropping of objects with isolated jerks. The patient will have kind of a little jerks, isolated jerky movements hongi, and twitching of fingers, dropping of objects, good prognosis. Sodium valproate is a drug of choice for this specific condition, and GABRA1 gene mutation. I have told 5 MCQs. The answer is 11111. Very nicely told. The answer is juvenile myoclonic epilepsy. The answer is juvenile myoclonic epilepsy. Very beautifully told by Shreya Krishna Mishra, Deepshikha Arora. We have Medicine Acharya. I am Donald, Surbhi, and Deepshikha again. Very good. Perfect. Sounds amazing. Next question, please. Achha, one more extra point. Okay. ABCC2 gene mutation you see in this Dubin-Johnson syndrome. Okay, what is the gene mutation you see in acrodermatitis enteropathica? Can you please answer in the comment, please? Acrodermatitis enteropathica. 5 more minutes, then this class is over. 5 more minutes, then this class is over. Quick answers, please. Where do you see the gene mutation in acrodermatitis enteropathica? Can you answer in the comment? Yes, very good, very good. Perfect. Very good. That's nice, Deepshika Arora. So, acrodermatitis enteropathica, where do you see? It is nothing but because of deficiency of zinc, and the gene mutation is nothing but SLC39A4. SLC39A4 is the gene mutation you see in acrodermatitis enteropathica, which is because of deficiency of zinc. Next question, please. If the patient of a juvenile myoclonic epilepsy, if she is a girl and she is menstruating, then what will you give? Very classy. Now this is a USMLE question. If anyone applying for USMLE, very nice, good, tricky question. We all know in a case of juvenile myoclonic epilepsy, the drug of choice is sodium valproate. That we all know. But now this girl who has this face suffering from juvenile myoclonic epilepsy, she is menstruating. Now what will you give? Will you give only sodium valproate, or do you want to give something else? Okay, very good. This Ahil Arshad only has given the right answer. Very good. So can you answer in the comment, please? What is the best answer for this question? It's a very important question, guys. Can you quick? Yes, right. Please remember, if the girl is menstruating, you will give topiramate, because as the girl is menstruating and sodium valproate is teratogenic, that is why then the drug of choice becomes topiramate. It was a USMLE question, and undoubtedly it can come in INI CET. Beautiful question. Where do you, bro? This is such a nice question. Wimberger sign, white line of Frankel and Pelkin's fracture. If this is the classical X-ray, what will you write and come? Will you leave this question and come, and then I will tell you full. I'll tell you class दूंगा तुम्हारी अगर question छोड़ के आ गए तो. If you, will you leave this question if it comes, or will you answer something? What do you think? Can you answer? Please. Yes, very true. You have 5 seconds. Yes. जहाँ मुझ पे हंसता खुशी मुझ पे रोती, अगर तुम ना होते, अगर तुम ना होते. This is an X-ray of vitamin C deficiency. Vitamin C deficiency is nothing but scurvy. Scurvy, the patient, like say, adult patient will come to you with bleeding of gums and everything. Okay, but whereas Barhal, this a pediatric patient basically on X-ray, my dear, you will see these all things: Wimberger sign, white line of Frankel, and Pelkin's fracture. And how will the patient present? The patient will present with scream while changing diaper. The baby will scream while changing diaper. Very important, that you should know. Okay, the baby will scream while putting clothes, the baby will scream while bathing, and the baby will scream while changing diapers. Did you understand? Has everyone understood? Yes or no? Please let me know in the comment. Yes, this is the classical picture of Keshan disease. Keshan disease, we have only 2 questions. Keshan disease. Keshan disease is because of deficiency of what do you think? We all know Keshan disease is deficiency of what? It is because of deficiency of number 1. Number 2, which is the most common congenital heart disease in the Keshan disease, and what order you see in a case of Keshan disease? Can you answer in the comment? Yes, very good. बातें ये कभी ना तू भूलना, कोई तेरे खातिर है जी रहा, जाए तू कहीं भी ये सोचना. That's true. Keshan disease is because of deficiency of selenium. Number 1. The most common congenital heart in Keshan disease is a dilated cardiomyopathy, and the Garlicki order. The patient will have Garlicki order. Did you understand? Very good. So this is also very important, bro. I want you guys to beautifully appreciate this point. ठीक है, समझ में आ गया? Has everyone understanding? Okay. I'll repeat again. Keshan disease because of deficiency of selenium. The most common congenital heart in Keshan is a dilated cardiomyopathy, and a Garlicki order the patient will have. Next question. What is the triad of yellow nail syndrome? What is the triad of yellow nail syndrome? These are like very good triads which we are discussing, image-based questions which had come in the exam. Okay. Last moment revision. Just nail it. Yellow nail syndrome. Sir, I don't remember yellow nail. No problem. I'll show you the picture. This is the picture. If I show you this picture, what will you write and come? Can you randomly guess something? ये क्या हो रहा है यहाँ पे? What? Can you see this pitting edema or something like that? So number 1, the patient will have lymphedema. As the name says, yellow nail. The patient will have discoloration of the nails. The NEET PG question and the INI CET question was, will you see clubbing in a case of yellow nail? The answer is no. You will not see clubbing in a case of yellow nail. Number 1, discoloration of the nails you will see. Lymphedema of the foot you will see. And respiratory. As I'm showing you a MR or a CT picture of this lungs. So respiratory manifestation. Respiratory manifestation could be URTI, could be LRTI, could be pneumonias, whatever you want to say. So respiratory manifestation, lymphedema, and a discolored nails are the triad for yellow nail syndrome, and clubbing is not a part of it. Last 2 minutes, then this class is over. Thank you so much, everyone. If I show you this picture, now this is the beautiful picture. Now what do you think, guys? As you can see, I am showing you the sinuses. So means the patient is having sinusitis. Second, I'm showing you the structure of the penis. Somewhere I'm talking about, I would say azoospermia. So azoospermia with sinusitis, I'm showing you a lung picture, which is basically showing bronchiectasis. So azoospermia with chronic sinusitis and bronchiectasis, I think anyone can answer. Even Oscar also can answer. Oscar, ये कौन से वाला है Oscar? I'm forgetting the name. Oscar, can you please tell me? Yeah, very good. Oscar is saying this is young syndrome. Very, very young. It could be youngs also. Some book says young also. Okay. So the young syndrome, very, very important. Please remember the triad of the young syndrome is chronic sinusitis, bronchiectasis, and azoospermia. Next question, please. Alport syndrome. What is the triad of Alport syndrome? Okay, someone says Cartaginer. Please remember, bro, in Cartaginer, you will not see azoospermia. You will not see azoospermia. Cartaginer, you will see dextrocardia. Cartaginer, you will see dextrocardia. I'll repeat again. Listen to me very carefully. One is Cartaginer syndrome, very commonly asked. It's like we're studying medicine over here today. Medicine plus beats. It's all run parallel. Listen, chronic sinusitis, bronchiectasis, and dextrocardia is a triad of Cartaginer syndrome. Whereas same chronic sinusitis, same bronchiectasis, but instead of dextrocardia, you see azoospermia. That is the triad of young syndrome. समझ में आ रहा है भैया या नहीं समझ में आ रहा? इज एवरीवन अंडरस्टैंडिंग? प्लीज यस पुट अ लाइक बटन. मुझे लाइक करें, सब्सक्राइब करें, शेयर करें. मेरी वोटिंग आईडी मेरी वोटिंग आज रात को 12 बजे तक खुली है. जय हिंद. Okay, perfect, perfect. That's right. Very well put. What is the triad of Alport syndrome? Some beautiful person has answered. Cheshta Arora has already answered this. Alport syndrome is also called as number one, hereditary nephritis. Alport syndrome is also known as hereditary nephritis. Number one. Number two, what is the triad of Alport syndrome? Sir, can you please give me a hint, sir? I am actually addicted to MCQ. No, sir. Please, can you give me some options? I'll show you the picture, dude. This picture number one, picture number two, picture number three. As for any picture, if I show you a ear picture, the patient will have deafness without fail, or you can touch to say sensory neural hearing loss. This is a kidney picture. Then indirectly you can tell me the patient will have hematuria. And this is the lens picture. The patient will have anterior lenticonus. The patient will have lenticonus. Okay, I'll repeat again. So the triad of Alport syndrome, kidney problem, hereditary nephritis. The triad is sensory neural hearing loss with anterior lenticonus and nothing but hematuria. That you should know. SNHL with anterior lenticonus and hematuria. Also, extra point I should know, what is this lenticonus? Cone shape, cone shape, cone shaped deformation of the anterior and posterior lens. Surfeit. Okay. Yeah, that's right. Blood X13 ID. He says can't see, can't pee, can't hear. Yeah, true, bro. I had read this mnemonic somewhere. मैंने कहीं पढ़ा था ये. Very well said. Beautiful. Okay, perfect. हाँ जी, आगे बढ़ते हैं. So this I understood. Anterior lenticonus you see in Alport syndrome. So Alport syndrome, the other name is hereditary nephritis. As I'm saying, nephritis kidney. It's a genetic disorder of the glomerular basement membrane. Okay. What is the inheritance? That is another high-fi question. 85% cases will be X-linked recessive. Autosomal recessive will be 10% and autosomal dominant will be 5%. Next question, please. Yeah. Very good, very good. Good question. The class has come to an end now. So please, has everyone understood? We have a I am Donald who says Apla 5. Yeah, but usually in hereditary nephritis, I tell you this collagen, this COL4A means type 4 collagen mutation. It's a type 4 collagen mutation. There's a mutation in the gene encoding the alpha subunit of the collagen 4. So collagen 4 mutation in Alport syndrome, which is also known as hereditary nephritis. The problem is in the basement membrane. Last question, then this class is over. Which is the most common cause of congenital hypothyroidism? Okay, which is the first most commonest cause, second most commonest cause, and third most commonest cause? Deepshikha Arora is already answering, and Nishma also answering. So beautiful. Answering so pyara. Very good. Very nice. Very nice. Yes. Very good. Yeah, you have 5 seconds to answer. Very good. Yes. तुमने हमसे कही थी जो बातें, उनको दोहराती हैं गम की रातें. तुमसे हमने कही थी जो बातें, उनको दोहराती हैं गम की रातें. तुमसे मिलने के दिन तो गए, हाय हम क्या से क्या हो गए. Which is the most common cause of congenital hypothyroidism? Now listen very carefully. Very simple question. Which is the most common cause of congenital, means by birth, hypothyroidism? Thyroid not working, which is the most commonest problem. Thyroid gland not working, the most common problem will be thyroid gland has not even formed only. Thyroid dysgenesis is the most common cause of congenital hypothyroidism, number one. Second, disharmonogenesis. The second most commonest cause will be hormone problem. I'll repeat again. The first most problem of the thyroid will be thyroid not formed, thyroid dysgenesis. That is the commonest cause for congenital hypothyroidism. Second is the hormonal problem, so disharmonogenesis. And which is the most common acquired cause? Acquired cause of what you called hypothyroidism. Then I would say autoimmune thyroiditis. Autoimmune thyroiditis. Yes, exactly. या अरे गम की रातें कैसी हो सकती हैं आपकी आवाज़ सुनने के बाद. ओह अच्छा जी, थैंक यू थैंक यू थैंक यू. That's it. I think that's it. That finishes this part, yeah. Finished. That finishes this class. And one more thing, please remember, as the most commonest cause of congenital hypothyroidism is thyroid dysgenesis, means thyroid gland has not formed only. So the indirect question was, will you see goiter in a case of thyroid dysgenesis? Thyroid gland has not formed only, dysgenesis. So you will not see goiter. When there is a disharmonogenesis as a compensatory mechanism, you will see goiter. Now, this is a beautiful point, must appreciate. In a case of thyroid dysgenesis, thyroid gland are not formed only, so goiter will not be there. Whereas hormonal problem, if I have a disharmonogenesis, then as a compensatory mechanism, I will have a kind of a goiter will be present. That you should know. Yeah. Oh, ho, ho. Mortius Lavi says, where are the images in this question? Oh, I don't have the images, but the other 1,000 images which I just showed you, just revise them. Okay. Thank you. That finishes this class. Thank you so much, everyone. And if you want, what do you want? If you want the PDF of this file, of this beautiful PDF, my mobile number you already have is 9999897081. If you want a PDF for this for revision, you can WhatsApp. I will share the PDF to you tonight. Okay. Before leaving, we always have a quick motivating quote, and the Q2 quote for today will be what? Will be this. In Hindi it says very beautiful. It says that बेहिसाब हसरतें ना पालिए, बेहिसाब हसरतें ना पालिए, जो मिला है उसे संभालिए. बहुत प्यारी कोट है, वेरी नाइस कोट ब्रो. विच सेज बेहिसाब हसरतें ना पालिए, जो मिला है उसे संभालिए. In English, beautifully it says, don't, just desire of something which you don't have right now. What you have right now, just take care of that and give your best shot in that. No, I wish I had a best friend, I would have studied better. I wish I had one more month, then I would have got a rank 1. Wherever you are, whatever you are, whosoever you are, whatever you have right now, put your best of the best intention, and results will come. Results will come. So that's what it says in Hindi also. बेहिसाब हसरतें ना पालिए, जो मिला है उसे संभालिए. What you have, make the most of this. Thank you so much, everyone. Please take care and have a wonderful evening ahead. That finishes the INICET rapid revisions. तो इसको अपनी आत्मा में डाल लो. Just put everything in your soul, and you are the most powerful. That's it. Thank you. Take care. See you around. Bye. Bye.